Hello, I'm Dr. David Clark.
Hi, I'm Monica. I'm with Clinical and Scientific Affairs for Bioclear.
We're here to talk to you today about the new Black Triangle kit. We're going to give you an update actually on the whole Bioclear Black Triangle scene. There's so much activity with this, this movement toward elimination of unfamiliar negative space. So we'll start with the new Black Triangle kit and then talk to you about some just general principles that we begin to understand after treating so many black triangles. So a lot of these post-orthodontic contacts are like this little point contact here. And when the retainer comes out, the teeth relapse this way or the teeth relapse this way. Retainer goes in, they line up. I've had a contact like this. They're unstable, it's part of the whole food impaction, they're more mobile, it's kind of miserable. So there's a real impairment of the quality of life of patients when they have these black triangles. It's a big deal, they can be painful. So what we want to do instead of this goofy little point contact is we want to come around, turn this way, Monica. We want to go back to back with this very broad contact, buccolingually and 𝐸𝐴𝐵. The teeth become periodontally stable and orthodontically stable. In fact, a lot of the times after we do the treatment, the orthodontist looks at the case and says, you know what? I'm not going to do a fixed retainer. We'll just do a removable retainer because of the stability of the tooth. All right, so let's go ahead and show that. So the first thing we talked about was that closing a black triangle is really a pair of contacts or a pair of matrices. So what we want to do is we want to always use two of these matrices to close each black triangle. And so that's the first thing that we're going to do. We have a new matrix with patents pending about having a nesting area or a pre-flattened area for each matrix. So rule number one, all matrices in the new Black Triangle kit have to be paired. All right? So the kit will come a variety of ways. We're just going to take a quick peek here. Is this the kit? So what you're going to have, is a little organizer. And then we're going to have matrices that for large and small incisors. Each one of these comes with 4 different curvatures. We've got a little pair of micro scissors, the Clark Explorer, and most importantly, we've got a new Black Triangle gauge. We'll show that right now. It comes with some disclosing solution. We know that blasting and disclosing the biofilm is key for success. And we've got these little contact sanders. This is also key to success. We have to manage, sand the contact, lighten the contact slightly to be able to get the matrices in. All right, we'll go through all that. All right, you excited? Let's take a look. So what we're going to be doing is I'm going to be showing how you decide what size of matrix to use and which of the 2 different sizes of matrices. So the first thing you're going to decide is this a big tooth or a little tooth? So we'll start with the small incisor actually. So we take a look here at the small incisor. So the small incisor is going to be for lower incisors or maybe a smaller lateral incisor on the maxilla. That's it. For everything else, we're going to use the large incisor. The large incisor is going to be for large maxillary incisors, maxillary canines, mandibular canines, and some laterals. So that's the way the system's broken up. Okay, next thing is we have to measure the black triangle space. So this is the black triangle gauge. It's not a probe, it's a gauge. So what you'll be doing is you'll take the gauge under the contact, this direction, to measure the actual black triangle. So let's take a look here. This would be a very small black triangle. And so you take this under the contact, and that would be a pink space. So what we do is you would grab a large tub, and you'd grab a corresponding pink pair of matrices. And then I'd put them in my little dish, and that's the maxillary midline. And so remember, each black triangle is closed with a pair of matrices. So the first thing we do is we take our saw and sander through the contact to make sure that we have clearance. This also removes biofilm. Now this is of course after we've gone in and disclosed and then blasted all of the biofilm away. Well, after we've disclosed and blasted, we're going to go ahead and sand the contact. The first one we want to take through is the blue saw. That is your scalp. That'll go through any black triangle area. Now I've conveniently marked all these black triangles with color coding on the teeth. That's probably not going to happen in nature for you, but it helps to keep me straight. Then we take the orange sander through the contacts, and you can go buccolingually or incisal-gingivally, and finally I'll take the red to make sure I have good clearance. This is going to be highly dependent on whether or not the teeth have a lot of potential crowding, how much sanding you have to do. All right, now we're ready to place the matrices. So once again, we measure the space and the gauge goes under the contact buccal lingually, and this has a nice engagement in the pink area. So it's the pink area, and then we're going to pick the 2 pink matrices. All right, so we slide these in, and you're going to rotate them in like so. Just a couple things to remember. You need to rotate it like so, and then if you're having trouble getting the last matrix in, that's one of the reasons that we built this little special Clark Explorer. It's very girthy, it's very strong. You can go in here and just pry here on the gingival to make room to slide the last matrix in. So that's a nice pairing of the matrices, and so that's 2 matrices that I'd use to close a black triangle, and this space is about a 1 millimeter space. That's the pink or red gauge area. All right, let's grab another case. This would be the yellow. This is about a 1.5 millimeter space. So I'm going to go ahead and do the same thing. I'll sand the contact here and make sure I've got clearance and make sure I've removed all the biofilm. And then we'll go ahead and grab a matrix. Once again, this is a large incisor, a maxillary central incisor. So now we're going to go ahead and grab the yellow matrices, like so. Once again, they're always a paired set of matrices. So I'm going to slide the yellow. And another thing to keep in mind is, this always happens, somebody puts the matrices in upside down. Invariably, someone puts them in upside down. The color goes away from the gum line. You know, it's always difficult to do something the first time. It becomes routine after that. What we try to do is create something that's more prescriptive and intuitive to simplify the procedure. So the matrices really should be seated evenly. If we've got one seated like this, it means you need to back out and bring them in together. Otherwise, you're going to have an asymmetrical black closure. So let's take a look from the palatal and zoom in. And that's a pretty good shape for this area. They have quite a bit of tension there. It's almost too tight. You could almost back up to a pink, but there's a lot of flexibility with the system. So that would be a 1.5 millimeter space. All right. So the next size would be 2 millimeter space, basically. And so this is going to be a pair of greens. I've already sanded this contact, so we'll skip that. And I've got a couple of green matrices. So we'll slide the greens in. And you'll notice we're getting a bigger and bigger black triangle. These bigger black triangles are more dramatic. I think they're really more fun because it's so impactful for the patient to have that black triangle disappear. All right, so Monica, I woke you up early to do this video. One of the things I wanted Monica to see here is that when we're doing consultations for black triangles, one of the neat things you can do to create an immediate impact is to have the patient in for consultation, measure the space, no anesthetics needed typically to do this. To do this, you just slide the matrices in, and then you can go ahead, take a little bit of flowable composite, and just, without etching the tooth, take a little flowable and inject and fill it on the facial, inject and fill it on the facial here, light cure it, slide the matrices off, the black triangle's gone, and the patient can really get an immediate sense of how beautiful and simple the procedure is. And then, of course, you take a little Explorer and flick it off, and the patient wants to put it back on. You say, no, no, this is temporary, because often we want to do more than just a black triangle. We'll use the whole injection molding process. But that's a great way. I think I saw a statistic that I think it was 77% of all the Invisalign cases, if you can show them their case before and after with the simulation, that there's a 76% case acceptance. So when we've done this with patients, where we just take the little flowable in and squirt it in there on the consultation and cure it, it's pretty exciting. And I think it really paints a picture. All right, now Monica's got a set of questions for me that she'll be asking in a minute. If you think of anything, Monica, go ahead and interrupt.
So, Dr. Clark, are there any times that you cannot use a black triangle matrix?
Good one. We're going to answer that in just a minute. Yeah, you keep me on track. There are some instances we'll talk about in just a moment. Okay, so the next one we're going to go to is the last size, which is the blue, and this one we're really going to go ahead and demonstrate. So we're going to take the gauge, once again, under the blue contact, like so, and you'll notice that that goes to the, so we start at 1, 1.5, 2, and then 2.5 millimeter black triangle. So we'll take a look at our gauge here. If we could push the soft tissue back, you can see this is a pretty large black triangle. And so we're going to go ahead and place the two blue matrices. I've also sanded this contact, so this contact is ready to go. So I'm going to flip it around here like when I normally work on a patient. Once again, we're going to rotate the matrix in like so. And on this matrix, you can really begin to appreciate the pairing. I'm going to zoom in here. You can see the pre-flattened area of the matrix as it's nesting with the other. Now, oh, that's a really big deal. That nesting is a really big deal. So what happened in the past, and with normal Bioclear, which is still important, and you'll need regular Bioclear for some of these black triangles, we'll talk about when, is that the matrix had a lot more curve. So what happened is one matrix would invert the other, and you can see that on the radiograph if you didn't pair them just right. And so we still need to understand that art. But for most black triangles, this is a much simpler way to go. I did a case, I think it was 40% better, 40% faster, 100% more enjoyable when I had the chance to use the new black triangle kit. So let's go ahead and do a setup as if we were going to go ahead and close a black triangle. Now we think of each black triangle as a pair of matrices, and we think about them embrasure at a time. But then I like to fill tooth at a time. In other words, half an embrasure, because as we injection over mold these teeth, we're not just going to close a black triangle. We're going to rejuvenate the tooth. We're going to make it a little bit thicker if the patient wants to have a brighter tooth. We're going to restore broken incisal edges, small rotations, mask some dark color. So if we injection over mold the whole tooth, it's a much bigger procedure than just a black triangle, much higher value to patients. All right, so let's give you an example of that. So let's say the patient had a very large black triangle between the maxillary central incisors like this, but then the rest of the black triangles were pretty small. So let's go ahead and gauge the other black triangle areas. And so as I look at this, the other black triangle areas are basically all pinks, which is not unusual. So what we're going to be doing is, in a case like this, we would be going around the arch and closing usually 5 or 7 black triangles. So either 5 or 7 black triangles is the norm for most of the cases that we treat. Because once you get started, you're going to want to have all the teeth color uniform, bring the color up, the brightness up, the value up of the case. So most of these cases, to get the optimal result, you're going to want to do more than just 1 or 2 teeth, typically. We've got the blue matrices set for the midline. And now we're going to create our aquarium matrix because we're going to want to injection over mold 1 tooth at a time. So now there's the distal, and then I'll slide this in here on the lateral. And we could be using a small incisor matrix here. You can see that this is a little bit too big. And we'll talk about the small series in just a moment. All right, so we're ready to injection mold. Now the next thing, which is important I want to talk about, is a lot of you that haven't used Bioclear yet, you say, wow, this looks great. How do I get in there? What do I do now? We'll give you a couple of tips. So to do the etching is pretty easy. You just insert the cannula of the acid etch in. We use phosphoric acid. We'll go ahead and etch the whole tooth, rinse and dry. And then you're going to want to use one of these micro applicators that works a little bit better than a bender brush. Can you give me a bender brush there, Monica? The bender brush, sometimes it's hard to get into the aquarium. So you can get your adhesive, massage it into the dentin tube just for 20 seconds. And we're using Scotch Bond Universal for that. And so the bender brush is here, and sometimes the bender brush gets sort of stuck. If you can get it in, the bender brush typically carries a little bit more volume of adhesive, so it really depends on the case. But if you're having trouble, this micro applicator does a great job of getting adhesive onto the dentin. We're going to air thin that, not light cure, and then we're ready to inject our flowable composite, or composite, if you're outside the United States. So we're going to go ahead and we would air thin our adhesive here, but we don't light cure. There's no reason to light cure unless you have a lot of freshly cut dentin. Then we're going to go ahead and injection mold the flowable, and here's how you want to tease this open. You're going to want to bring the flowable cannula in like so, and then start injecting as far interproximally as you can. And we'll show you a clinical video on that. Once you've filled up the interproximal, you're going to coat the contact. Then you'll come over here, go under the embrasure, inject slowly all the way to the palatal, fill the entire facial, and then up and do the contact. Then we typically fill the entire lingual with flowable composite. We'll just rotate the patient's head around here, right? We'll inject the flowable composite here and basically fill the lingual. Like I said, we'll show you a clinical video on that. Then what we like to do I know it's a little bit of extra work, but it really transforms the tooth. The next thing that we'd really like to do is to take the paste composite, the regular composite, and inject it onto the facial, because that allows us to restore incisal edges with a lot more confidence. It has better shine retention, better polishability. So we'll push the heavy composite, like so. It's coming out already. It's already heated. We'll push the heavy composite into the flowable, displacing most of it toward the lingual. And so the way you start here is you have to find an access port. So I'm going to come in. And open the window like so, and then I'll inject under the matrix back and forth like this. You'll see it in the video. And then simply take my instrument and close the window like so. Just massage it gently. Don't over massage. You only want to massage on the line angles here. Don't push too much up and down at the edges of the matrix. You'll just get a pumping action and bubbles. Just massage here and here. And then right before you light cure, you'll take a dry brush and get a dry brush for each embrasure and clean up the interdental area just like a porcelain veneer. And I would use a fresh dry brush for all 4 corners, 1, 2, 3, 4. And then we just go ahead and light cure. And of course, 20 seconds on each area, and 20 seconds on incisal and gingival. And then for final disassembly, what you always do is you will take your neighboring teeth off. Now we call these the shield matrix or the shepherd matrix. So what Monica here, I got to keep her active. What 2 things are the shield matrix or the shepherd matrix going to do while we're injection molding? In other words, these 2 were the aquarium. These were the ones we were actively using, and these are passive matrices. So what are the 2 things, Monica, we talk about for the shield?
Protecting the space.
Right. So when you injection mold, you create a lot of pressure, and you can push that matrix over. So it's protecting the space, and then what's the second thing?
They're keeping composite from getting on the neighboring tooth.
Right. So what you'll do is you'll take the shepherd matrices off, or the shield matrices, put them in the little tub, and we're going to use those later for an active matrix. And then we have to take our Clark Explorer and basically peel these matrices off that we've just used. So the way you peel these off is you want to completely release the matrix, like so, and like so. And then I like to slide them incisal gingivally. Because they have so much stiffness, sometimes it's uncomfortable to rotate them facial lingually. So we'll just pull them out incisally. Okay, and then if we were to continue the case, we would simply grab the matrix that was our shield matrix and just go down the line and do the next 2. So that would be our next active matrix here. In this case, probably would be smarter to use the small matrix. Next thing is trimming. We typically try not to trim these matrices, especially at first, because then you lose your color coding. We can normally do this without any trimming. The only trimming that you might have to do is you've got just a little bit of a scallop here on the matrix. And every once in a while, that gentle scallop right here, because with the black triangle, you typically don't have much of a scallop. What you can do is sometimes, this will be bending over or impeding the insertion on the palatal. So all you want to do is clip that little bit on the palatal. I'll give you an example for this. So I clipped the palatal. So if I was working on this tooth, that palatal extension would be a little bit more forgiving here if you feel like it's stopping the insertion of the matrix. And how we know that the matrix is not fully inserted is if you're pushing on it and you see a gap like that, it's being held up somewhere, and it's usually the palatal. So trim that palatal flange if you think it's hanging up. But that really, I very rarely need to do that with the cases that I've treated. The next thing we're going to talk about is lower incisors. So we've got a little model here with lower incisors. So I'm going to do the same thing. I'm going to go ahead and gauge the contact areas. So I'm going to go ahead and slide the gauge under the contact, just like so. And so that would be a yellow space, about a 1.5 millimeter space. So let's do that again with less coffee and less jiggling. How about that? All right. So here is the yellow space. And so we'd be using a pair of yellow matrices for this lower incisor. So here is the small incisor kit. And so I'll grab a couple of yellow. I'll go ahead and slide these in like so. on that midline. And remember, the matrices always have to be paired. So we'll talk about an instance where they, where we're filling one tooth, it's really not going to work so well, or a super tight embrasure. So you look at this, you say, you know what? That contact maybe needs to be a little bit broader, maybe need a little bit more curvature. So you can do what's called going off-label. So now we're going to jump ahead to what we call going off-label, or variations of the norm. These things normally don't happen. I really don't want you to go off-label and try anything exotic unless you're adventurous in your first few cases. But in a case like this, if you wanted to change the inclination of the tooth, or you felt like you needed to mix and match, in theory, it's fine to take a green and yellow and try and close a space, just because on this particular case, for some reason, the inclination of that tooth made it more favorable to use a green and yellow together to get a better pairing. Now, I don't want you to try this right off the bat. Typically, the system is so forgiving, you don't need to do that, but feel free, like I said, to go off label. The clinical case that I showed, I decided to change the inclination of the tooth by using different, I wanted to change the canting of the tooth, so it's okay to mix and match. And so the last thing I want to show you is, what about these little tiny narrow spaces? It's not really a black triangle, it's like a sliver. So you asked me, Dr. Clark, what do you do when do we not use the system? Yeah, so we still have Bioclear 1. So what I'm going to do is I'm going to grab the gauge here. We're going to take a look at one of these sliver contacts that we sometimes get when orthodontists do a lot of IPR, interproximal reduction, and this space is like this long, narrow area, and it's not really a black triangle, it's like a black sliver. So if I can't get the gauge in at all, like I cannot get it in here at all, this is not a good place for the new black triangle matrix. What you're going to want to do in a particular case like this is I would grab an A103 from original Bioclear. So I'm going to grab an A103, and I'm not even going to use the HD, which is the heavier version. I'm going to use regular Bioclear because the space is so small. So I'd grab a couple of A103s, and I'm going to know right off the bat, the pink system of Bioclear has about the same curvature, about 0.5 millimeter. There's no way that they're going to fit. So what I'm going to do is take my scissors, and I'm going to trim. This is original Bioclear. I'll trim a little V just like this. Make sure the edges line up, just like a little paper doll. And that's a pretty reasonable flat V for a black triangle. And I'll slide that in. Once again, we always take our saw and then our sander through the contact to make sure that we've lightened the contact so the matrices aren't fighting on their way in. And then we will slide these matrices in like so. And so for a narrow black triangle like this, this is when we don't use the new black triangle kit. It just doesn't work. So that's the one exception, is really narrow, and the gauge will tell you. If the gauge does not go in at all, that's the case for regular Bioclear, and you're going to have to trim, because regular Bioclear still has a fair amount of curvature in the pink system. And so that would be an indication for regular Bioclear. And don't forget, whenever you injection mold, the matrix can swell quite a bit. So let's take a look at my pairing there. That's not bad. Man, that's a tiny space. That is a really small space. But patients are going to see that, and they're going to want to have that closed in addition. So it's probably not that common, but you will run into that. Now, the last time you said, when do we not use the black triangle kit? If we're doing a single tooth, and we're or the last tooth in the arch, and we're not going to pair the matrices. Let's say we're going to do the distal. If we finish the arch form here, for example, if we finish the whole arch and we want to do the distal and we only want to close half that space with one matrix, this matrix may not be your best choice depending on the aesthetics. So for example, if we put a pink matrix in here, when we're finishing up the case, doing the last tooth in the arch, we try to always put an aquarium, even if I'm not even doing the last black triangle, like if I was not technically including the distal of the canine in the case, you could either use regular, you could either use the new Black Triangle Kit Matrix for the distal, even though it's a single one. I'm going to give myself the proper space here, and we're going to set up, we're going to talk about the distal of this canine. If we had finished the case and we wanted to injection over mold this canine, the question is, what about the distal? So I think that you could certainly use the pink on the distal here, but if you felt like the contact area was going to be too flat, because we're not doing a pair of matrices, I mean, it's the distal of a canine. It's not a place where we have to be that fussy. You could always go back to regular Bioclear and place an A102 matrix on the distal or something like that. Yeah, is it an A102? There we go. Okay. So this is an excellent little black triangle matrix. You can always resort to the A102 here because it does not have the pre-flattened area. So you can mix and match, but in reality, 95% of the time, all you're going to need is the matrices from the Black Triangle Kit for standard cases. All right, so I think I've covered everything, Monica. What else are we supposed to talk about?
How do you like to promote treating black triangles in your practice? Okay,
there's a couple things we want to do. If you're doing photographs, if you're not doing them, you need to do them. And Dr. Kim, my partner, said, hey, you need to let the staff do it. In the beginning, the photographs were not great, just like they weren't great for me. But now the staff does the photography. Make sure and take air and dry the teeth aggressively and take multiple angles to show all the black triangles. And when you grab the little brochure, the next thing you've got to do is you've got to put these brochures on the counter and in hygiene somewhere. I had a patient that was in the practice literally for 5 years after we were doing black triangles. 5 years goes by. He walks by this brochure and he finally says, you know what? I got a tax refund. I think I want to do something to my teeth. They're looking kind of beat up. I don't know exactly what it is, but this thing looks pretty great. He ended up doing a whole black triangle and diastema closure case. So if those things aren't laying around in your office, it's going to be hard to talk about it. And so you need to add black triangle treatment onto one of your aesthetic menus on your website. It's good to get your staff excited. They need to know what the heck you're doing. And then one of the things we always encourage you to do is to come to the Learning Center and get certification in the classes, or just not just certification, just to learn a lot more about all the possibilities of Bioclear method. And then as patients who are, it's getting quite significant, go online looking for Bioclear treatment because it's patented, it's trademarked. Patients are looking for the Bioclear method and treatment for doctors who have had certified training. Okay, so that's one thing. What else were we talking about?
So the last question I have is, how do you charge for this?
Oh, I always forget. How do you charge for this? Okay, we charge by the black triangle. So basically, each black triangle is a pair of matrices, right? And a pair of treatments. So each black triangle has, like, for example, the mesials of both front teeth. So it's basically like doing two large composites, if you want to think of it that way, but that's not how we think about it. We think about it as per black triangle. And don't compare it to bonding, because bonding is hand manipulated. It's not at the same level with injection molding. So we compare it really with our porcelain laminate feet. Mm-hmm. So if you're going to close a black triangle, you would need to use 2 veneers. If you had 2 black triangles, you need to use 3 veneers. So really start with your porcelain veneer fee in mind. So if your porcelain veneer fee is $1,200, and realistically you could charge something along the lines of $2,400 for a single black triangle, and that's not what most people charge. But you should start there because it's a procedure that involves some training and a little bit of training and some equipment. And so the average range of fees for treating a black triangle would be somewhere between, say, $500 and $1,200 per black triangle. So more along the lines of a porcelain laminate fee. Typically, it's not covered by insurance. Once patients understand that, then it becomes a lot easier to have those conversations. And frankly, patients want this. They really want this. You don't have to beg them to do the treatment. They're waiting for someone to say, hey, are you sick of these black triangles? It's a conversation that's not happening. And the minute the conversation happens, boom, people start asking for it. Because we've never really treated it before. We treat bleaching, we do adult orthodontics, but the black triangle treatment is only going to happen if we have a conversation that's happening in our practices.